like here, then you could do here, or okay. I prefer to face the black. If I can. I do. That's what I hear. Okay. So I take my phone. I'm gonna ask. I'm gonna ask Sydney. Okay. I don't think I am. I'm trying to do that. No.
Good afternoon, everybody. Oops, sorry about that. I am joined today by Police Commissioner Harrison, Fire Chief Niles Ford, Dr. Daraja, our Health Commissioner, for the first time, Shantae Jackson, our incoming Director of the new Mayor's Office of Neighborhood Safety and Engagement, are here today, and we're also joined by Sonny Schnitzner, our Deputy Mayor for Public Safety. We are here this afternoon for a joint public safety and COVID-19 update. Standing here in January 2021, it is imperative that we understand the current state of safety in our city and begin discussing how we will be making changes as we move forward. I'd like to first turn it over to Chief Ford to give an update on the fire deaths in our previous year. Chief Ford.
Thank you, Mr. Mayor. Good afternoon, all. I am constantly speaking with my members about public safety and about the vital role we play as first responders, which is to help people on perhaps one of the worst days of their lives. And intentionally, I emphasize my ultimate goal of having 0 fire fatalities. And every year I reiterate that it is our job to protect and to safely look out for the community. Ending 2020 with 7 fire fatalities is a huge accomplishment and a step in the right direction. While the families and friends of those we lost remain in our thoughts, they remain in our prayers, and we certainly don't marginalize them. Reaching this milestone means we are taking a step closer to accomplishing our goal of 0 fire deaths. As first responders, 7 not only represents the number of fire fatalities, but it represents progress. 7 is a representation of our unwavering commitment to help others. It's a representation of the dedication demonstrated by each member of this department. I had an individual reach out to me through social media and ask me what was the special sauce in us basically making this accomplishment and this historic accomplishment. And I really told him there's no special sauce, and if there is one, this is it. From the 911 call takers and all the hard work and, quite frankly, some of the thankless work and unappreciated work they do, to the fire communication specialists that dispatch the calls, to the firefighters and EMTs and paramedics that train every day and work really hard, to the fire marshal's office who does allow the pre-fire plans and go through the trouble to make sure that the buildings and everything are as safe as possible, to the officers that take charge on the scene. That's where the special sauce is. Everyone played a role with increasing public safety and decreasing the total of fire deaths. As we move into a new year, we remain ambitious about upholding a safer community for everyone and continuing our charge forward to lowering fire fatalities, prayerfully to 0. Also, I would like to remind everyone to check their homes for working smoke alarms. As Baltimore City residents, you can call 311 to have the fire department come out, conduct a safety inspection, or not a safety inspection, a safety sweep rather, and install smoke alarms where needed. Again, I want to encourage you, if you do not have a working smoke alarm, to call 311. Thank you very much, Mayor.
Thank you, Chief Ford. We are very proud of the work of the women and men of our fire department and the life-saving work that they continue to do each and every day. It does not go unnoticed, not by myself or by the citizens of Baltimore. Before I turn it over to Commissioner Harrison to talk about where we stand as a city on crime and the violence we've experienced in the first week of 2021, I want to say a few words. 8 days into the new year, we have already lost 5 people to violence, and we have 9 others who have been shot. This is exactly where we were at this time last year, and that's not acceptable. We can never, and I will never, accept this as normal. No Baltimorean should accept this as normal. And no one committing a violence, pulling a trigger, or taking advantage of our neighbors should feel comfortable. I'd like now to have Police Commissioner Harrison to step forward to provide an overview of where we are as a city, discuss the year-end initiative that was ran by BPD, and provide an update on where we are this year. Commissioner Harrison.
Good afternoon, and thank you, Mayor Scott. Every day, the men and women of this department go out to serve in some of the most challenging and dangerous circumstances. We continue to target and apprehend those causing harm in our city. And to that end, in 2020, the department saw decreases in both violent crime and in property crime. Now, while we saw modest reductions in both murders and shootings, with a 4% reduction in murders and then a 6% reduction in non-fatal shootings, we know that way too many people were harmed and killed through murders and shootings, and the city is still way too violent. We saw a 32% decrease in robberies. That gave us an 18% overall decrease in violent crime, and then we had a 29% decrease in property crime, with an 8% decrease in aggravated assaults, and then double-digit decreases, 8% decrease in assault, and then double-digit decreases in all the other property crime indicators, giving us a 26% overall decrease in overall crime, which are all the major crime categories. Now, while these numbers are positive, I can assure you we will not rest. We are committed to working even harder to realize more reductions in 2021. We continue to lose way too many young men and women who often look like me and those of us standing here today. As the mayor said, there were 5 homicides this year along with 9 fatal shootings, again, which is exactly where we were this very same day last year. And the downward trend in robberies continued through the first 8 days of this year. In 2020, our officers also focused their efforts on identifying and apprehending people responsible for violence in Baltimore, including taking illegal guns off of the streets. We saw a 12% increase in arrests for those illegally carrying guns on the streets of Baltimore. Just this week alone, we arrested 21 individuals for illegally carrying guns on our streets, which is a precursor to being a shooter or a victim of a shooting. But we also know that building trust in our police department and in our community is critical for public safety, and it is our commitment to do just that, as we are working to bring justice to families victimized by this pervasive culture of violence in our community. Earlier this week, the department announced the results from a 2020 year-end initiative that focused on deterring and preventing robberies, specifically carjackings and commercial robberies. This effort led to a decrease in carjackings by 23% and commercial robberies by 41% in December. Through this initiative and others, the department continues to address the concerns of our citizens, and we remain laser focused on repeat violent offenders and those who continue to victimize our neighborhoods. Our detectives have been working around the clock to identify and apprehend those individuals for several violent crimes in this new year, to include homicides and shootings. And in this new year, we've announced the arrest of a murder suspect and 2 suspects responsible for 3 non-fatal shootings. 26-year-old Lakira Doherty was arrested and charged for murder and assault following an incident on New Year's Day in the 1200 block of Stricker Street. We also arrested 61-year-old Ronald Williamson for a shooting and 36-year-old Eric Terry for shooting 2 victims that occurred over the weekend. And Tuesday night, we had a double shooting in the 2200 block of West Baltimore where a male and female were sitting inside of their vehicle and shot. The female is in stable condition. The male and female are in stable condition, but the male is in critical, rather. Anyone with information about this incident is encouraged to call us right away or call Crime Stoppers right away. And you can do it anonymously, and there's tip information available for you. Today, we are asking for the public's help in assisting us in efforts to remove violent offenders from the streets of Baltimore. We have identified 5 individuals wanted on various violent warrants, and these suspects are 43-year-old Kente Gwaltney, wanted on 5 open warrants, to include rape. 30-year-old Sean Williams, wanted on 4 open warrants, to include assault and burglary. 34-year-old Lawrence Scott, wanted for rape. 43-year-old Rodriguez Woodland, wanted for first-degree assault. And 27-year-old Christopher Jones, wanted for multiple charges, to include armed robbery. So if you know the whereabouts of any of these suspects, we are asking you to call our warrant apprehension task force at 410-637-8970, or those who wish to remain anonymous can call Metro Crime Stoppers tip line at 1-866-7-LOCK-UP. You can also anonymously text a tip by visiting the Metro Crime Stoppers of Maryland website. Together we will make Baltimore a safer city, but it won't just be those of us standing at the podium. It will be all of us, from implementing comprehensive solutions to providing pathways away from violence for our young people, and to our businesses, churches, and nonprofits, trauma care initiatives. All of us working together will cure the epidemic of gun violence in our city. It will be all of us working side by side to reduce the violence, making our city stronger and safer. And thank you.
Thank you, Mr. Commissioner Harrison. Now, let me be very clear. I appreciate the hard work and dedication of women and men in BPD and the reductions that we've seen across a number of categories. But that's not enough for me. This is absolutely not a time for us to celebrate. We have to recognize that as progress, but understand that we have to go even further. As mayor, I will be holding all of our agencies accountable for how we reduce violence, beginning with BPD, and to higher standards. I am monitoring our progress every single day and will not accept anything short of complete and total dedication to making our city safer. We have to, and we will build on these gains. We have to get a hold on the flow of illegal guns coming into our city. This is something that our administration will be very focused on. We will focus our efforts on the people committing violence in our neighborhoods, and we will also work to ensure greater accountability. If you commit a crime and wreak havoc on our communities, you will be held accountable. The status quo will not cut it. We are still losing far too many of our brothers, sisters, sons, everybody on the streets of Baltimore too far often. It's unacceptable, and the trauma and pain that it causes for families and communities can be felt for decades. These losses are something that no one can ever replace. These are people that will never get to celebrate holidays with their families again. These are grandmothers who now have to take and shoulder the burden of taking care of grandchildren because their parents are gone. This runs deeper than just that incident. The lives impacted are limitless. I look forward to working with our new director, Director Jackson of the Mayor's Office of Neighborhood Safety and Engagement, as we build a strategy that not only connects our city agencies together to work on violence reduction, but also important thing that we have not done well in the past, working with our community partners who do this work each day on the ground. Please expect to hear more information about that in the coming weeks as Director Jackson begins to work. We know that this is an important thing for us here in the city of Baltimore. We know this today marks my 4th week in public office, and I think that there are many messages that we're going to share here today, but this is the most important. We will not accept violence to continue at this rate in Baltimore City. We will recommit ourselves fully to the work of prioritizing the lives of Baltimoreans by addressing trauma, prioritizing public health, and building public safety together as a city in 2021 and beyond. I have no illusions about how tough this work is. This is what keeps me up at night. This is not overnight work, but we have to begin that work today. But I want everyone to understand that we will be holding these updates more frequently to be more transparent and make clear what the city is doing to combat violence and build public safety. Over the next several weeks, you will be hearing about how we are going to get there. I also want to say this very clearly. Expect changes. We will not continue with strategies or approaches that are not serving our city and that are not helping to make our neighborhoods safer. My administration will be announcing additional initiatives and steps related to public safety in the weeks ahead, but I also wanted to highlight something very in particular in reference to some of the arrests that the police commissioner referenced. A significant amount of the violence we've seen so far this year has involved what we call intimate partner or domestic violence related incidents and disputes. Yes, we all know that we're in a pandemic. Many of us are cooped up in our homes, but we can never accept intimate partner violence as okay. And this message is particularly for the men out there, but for everyone. You don't own anyone else's body. She doesn't belong to you. He doesn't belong to you. Even if you're married, even if you're in a relationship, or if you think you're in a relationship with someone, it is unexcusable to put your hands on someone or take someone's life just because they don't want to be with you. That goes for the same goes for child abuse. We will not tolerate that. We can't tolerate it. All life is precious, and we cannot become desensitized or devalue the lives of our loved ones. If there is anyone out there who finds themselves in a situation that they need help with, whether someone in a relationship or someone experiencing violence at the hands of their parents or a caregiver, please know that there are resources for you. One of those resources is the House of Ruth 24-hour hotline, which is 410-889-7884. Again, 410-889-7884. You can find more information on developing a personal safety plan, guidance on petitioning the court for a protective order, and a full list of resources at mocj.baltimorecity.gov/domestic violence-resources. Again, that's mocj.baltimorecity.gov/domestic violence-resources. Again, you do not own her. You do not own him. We cannot continue to see people lose their lives, be battered, or just be preyed upon in this way in our city. Thank you, Chief Ford and Commissioner Harrison and Director Jackson for your updates. Now I want to switch a little bit and go to COVID-19. As of today, January 8th, Baltimore has had 33,522 cases of COVID-19. This number is down 22% from 4 weeks ago. We have 461 people hospitalized with COVID-19. Our ICU utilization is at 90%. Again, I'll say that again, 90%. And our acute care utilization is at 89%. And we are now at 671 deaths in Baltimore City. I want to again thank everyone who continues to act responsibly and take COVID-19 seriously. I want to thank our vaccinators who have made the city's vaccination rollout announced on Tuesday a success. To all of the health professionals and public servants at the health department and Dr. Jaraza, who will ensure that Baltimoreans are getting the vaccine as they should in the pyramid. I again want to thank Under Armour for allowing us to use their facility. Again, to recap, Baltimore's distribution plan announced Tuesday will have health care workers and first responders beginning in Phase 1A this week. My administration is completely focused on ensuring that this vaccine is distributed both efficiently and equitably across our city. Now that our system is up and running, we expect to see increases every day in the amount of people vaccinated. On Tuesday, I said that I will be assessing the key metrics on a daily basis with Commissioner Duraza and our hospital partners to make an assessment on our current COVID-19 guidelines. Today marks 1 month of Baltimore's return to a modified Phase 1 and a tighter and tighter mandates that I put in place for activities that require you to remove your mask. After reviewing the data around case rate, positivity rate, hospitalizations, and deaths, we are seeing a bump following New Year's Eve. As I noted, our hospitalization rates are up, just as we had consistently seen following Thanksgiving, Hanukkah, and the Christmas holidays. With that in mind, I have made the decision to continue on with the modified Phase 1 guidelines in Baltimore City. We will take the next week to continue to closely monitor the data on a daily basis with our health commissioner and hospital partners. Again, we will be considering case rate, positivity rate, hospitalizations, and deaths, as well as projections from our partners. All of that data and expertise will inform the decisions that we make. By this time next week, we will have 2 weeks of data following New Year's Eve, which will allow us to reassess accordingly. I want to be clear. Before the bump from the holidays, Baltimore saw a dramatic decrease in cases following the new mandates. I will return to you 1 week from today, on Friday, January 15th, with a decision made regarding our current guidelines after fully accessing another week of data. Additionally, based on the input the city has received from the community, and I want to emphasize this, I am committing that any change to the current guidelines will be given with 1 week's notice. This is to give everyone, but especially our restaurants and local businesses, adequate time to prepare and make adjustments as necessary. I want to turn it over to Dr. Terraza to talk more about the data we've seen following New Year's Eve. Dr. Terraza.
Good afternoon, and thank you, Mayor Scott, for continuing to lead and inform the public about Baltimore City's COVID-19 pandemic response. I'd like to briefly share the data on key COVID metrics for Baltimore City. As of yesterday, as Mayor Scott mentioned, we have lost 671 lives to COVID-19, and we are averaging just over 2 deaths per day. We have had a total of 33,522 cases here in Baltimore City. That is an increase of 1,027 cases since Tuesday, when we were at 32,495 cases. Our latest 7-day average new case count is 221. This is an increase of nearly 43 cases per day since Tuesday, when the average was 178.6. Our latest 7-day positivity is 7.1%, an increase from the rate on Tuesday, which was 5.3%. As Mayor Scott mentioned, our hospital utilization rates remain very high, with an ICU capacity at 90%, and our acute care is following closely behind at 89%. We are pleased to see that some of our metrics are down slightly from where we were 4 weeks ago, indicative of early success of implementing modified Phase 1 restrictions here in Baltimore City. However, it's important to contextualize those numbers. We're now witnessing reduction in new cases and positivity from the highest peak since the beginning of the pandemic. We have not seen a return to normal or moved away from what we know is widespread community transmission. Additionally, we are only beginning to see the results of holiday travel and gatherings since Christmas and New Year's, and have already seen a slight increase this week, likely related to those holidays. The amount of widespread community transmission occurring in Baltimore City now remains a significant threat to overwhelming our hospital systems. We have not yet seen a dramatic decrease in ICU or acute care admissions related to COVID since implementing our Phase 1 restrictions. We're still averaging more than 200 cases per day, well above what we're comfortable with, and above our previous peak this summer. And more importantly, our hospitals are continuing to experience major surges that threaten their ability to continue providing adequate care. To reiterate points made by myself and Mayor Scott, these tough restrictions are guided by the metrics, including case count, positivity, hospitalizations, and death, that indicate we continue to experience widespread community transmissions. Our hospitals serve not only Baltimore City residents, but residents across the state. Those hospitals were on a dangerous trajectory to potentially being overwhelmed a few weeks ago, and I remain concerned about our hospitals being overwhelmed today. Keeping high-risk locations closed gives time for hospitalization rates to decrease and to ensure that our hospitals have enough space and staff to deliver high-quality, life-saving care to the patients coming through their doors. We will continue to monitor key reopening metrics and will report out our findings regularly. All of this information is publicly available and can be found at coronavirus.baltimorecity.gov. I would also like to take a moment to update residents regarding Baltimore City Health Department's efforts to distribute the COVID-19 vaccine. Due to limited initial supplies, the Health Department has worked very closely with the Maryland Department of Health and other health departments across the state to develop priority groups to ensure near consistent prioritization across the state. In Baltimore City, we took into account specific population factors and priorities to tailor that sub-prioritization to meet the needs of residents here in the city. Today, I am pleased to report that in addition to the thousands of vaccines distributed by hospital systems to their employees and the vaccines distributed to residents of senior and assisted living facilities by CVS and Walgreens, the Health Department has provided 842 vaccines to EMS, fire, police, health department employees, as well as urgent care, dialysis workers, and frontline judiciary staff as of yesterday in our first 3 days of vaccination at Under Armour's Port Covington campus. We remain grateful to Under Armour for their partnership in securing a safe location to distribute vaccinations for city employees and healthcare workers. We also appreciate the support of our clinical partner volunteers from Maryland Responds and Coppin State University. In accordance with MDH guideline, beginning on Monday, January 11th, all members of Priority Group A, including all non-hospital-based, licensed, registered, and certified healthcare providers or individuals who work in Baltimore City healthcare settings or who live or work in Baltimore City, will be able to sign up for appointments by visiting our website, coronavirus.baltimorecity.gov/COVAX. That's COVAX. Baltimore City is home to a number of healthcare professionals, both hospital and non-hospital affiliated. So our priority group 1A may be larger than other jurisdictions. Nonetheless, our clinical staff is confident in our ability to scale up our vaccination operations to serve our priority group 1A populations. Again, definitions of who are in priority group 1A can be found at coronavirus.baltimorecity.gov/COVAX, COVAX. Earlier this week, I told you all that the vaccine is here. It's no longer a possibility, but it is a reality. I've committed to being transparent during all phases of our vaccine rollout, and to that end, our clinical teams have been working through and troubleshooting technical and logistical challenges as they've written, including a number of last-minute appointment cancellations and no-shows. We're working closely with our state partners to troubleshoot these issues, but early reports suggest that a number of Baltimore residents and Marylanders from other jurisdictions not in Priority Group 1A sought to get a vaccine early. All those seeking COVID-19 vaccinations during Priority Group 1A must show identification and documentation proving they are residents of or work in Baltimore City and are Priority Group 1A members before they are admitted into the vaccination site. Due to this scrutiny, we remain confident in our ability to prioritize vaccines for those identified groups, but remain concerned about abuses in the system. If you're not a Priority Group 1A member, please do not attempt to sign up for a vaccine at this time. If individuals show up who are not part of that priority group, they're taking away appointment slots from those individuals in Priority Group 1A. In the coming weeks, we will be updating our dashboard to include information about the number of vaccines distributed. In the meantime, we ask for your patience and your honesty as we are working through vaccinating Priority Group 1A, so that when we move to later phases, we have built a base of healthcare workers and first-line responders who can assist us in vaccinating the general public. In the meantime, please continue to wash your hands, maintain social distancing, and wear a mask in public to reduce the chances of disease transmission. Thank you.
Thank you, Dr. DeRaza. We have not seen the full impact of the holiday yet, so we don't want to reopen too soon. I understand this is frustrating for our restaurateurs and their employees, but as always, our decisions in Baltimore are made with the health and safety of our residents in mind, and we will continue to be guided by the science and the advice of our public health professionals. I ask our restaurants, business owners, and residents alike to have faith, patience, and continue to trust in the process from our public health professionals as we continue to navigate this pandemic together. And with that, we'll take a few questions. Go ahead.
Mayor Scott, how are you?
How are you?
Thank you. Some of the economists that we've spoke to about the future of the city regarding, some of the closures that we've seen of these major restaurants, it seems like a bleak outlook. Who on your team have you been talking to about how we get past this when we move to the future and things do open up?
Listen, so first thing, again, the first thing and most important thing here, right? Lives are more important than money. We have to understand that. You know, our economic team, our folks in the city, VDC, we're all going to be working to support, as we have. I know we've said this to you now probably 30 times. The millions of dollars that we've put out, we're going to be working with our congressional, our state delegation as we now have a new round of money, and we'll be working to get that out to people. And this is something that we understand, right? We know this is tough. We know this is hard. But we also know that people are dying. And that's the most important thing that we have to understand. And we're going to be there to support our businesses. We're going to be there to do whatever we can do to make sure that they remain strong and make it through this. Together we will do that, but we will not put money over people. Next question.
Mayor, this deals with the issues dealing with crime in the first
Yes, sir.
Part of the year, and also with last year. One of the things you talked about and also the police commission dealing with domestic violence, and this was also an issue last year as well. Have you come up with any new initiatives and things that you're going to do, like right now, or what are you trying to do dealing with that?
So, you know, I never want to give out too much detail about how we're going to be actually doing public safety initiatives, but I think it's important, and Barry, to remind yourself of this, that we're 1 month in, right? Mm-hmm. And when you're talking about a city that has never had a comprehensive approach to dealing with violence in the city, that has never had an office dedicated to dealing with neighborhood safety in the city, these are the things that we're going to be built. This is why we're assembling this team, so that we can attack all of these issues in a different way. We have our partnerships in our office that we deal with folks who help with intimate partner violence. We're going to be working with them to expand their work, but also to expand our reach into neighborhoods themselves. Ava Joy?
Hi, Mayor. So this doesn't have to do, I know this is outside of you guys' jurisdiction in Baltimore County, but it has to do with your constituents. The assistant principal at Dunbar High School who was killed, we're now hearing that an arrest has been made. Can you just comment on that? Because we know many people in Baltimore City were hurting about that.
Well, we're all hurting. We're talking about a young man who dedicated himself to making sure that young women and men in Baltimore City could reach their fullest potential. And to have someone who has breathed life and hope and lit a fire into so many young people just have their life just taken out like that, it hurts. When you know young people that went to Dunbar or any other schools that he worked at, and you can see online the outpouring of students saying how much he meant to them, the whole city hurts when something like that happens, even though it didn't happen here in Baltimore. And we just pray for his family, pray for the entire school system in Dunbar in particular as they deal with this tragic situation, and hope that justice is brought to bear. Next question. Dan, let her go. They haven't asked a question yet.
Recently, the governor suggested sending in the National Guard to assist with your vaccination efforts. Have you spoken to him about that prospect, and is he going to make good on that promise? No, we have not. We learned about that the same way you did when the press conference happened. What we will do, and I know that Dr. Raza will talk a little more about that, we will work with our state partners and continue to work with them as we navigate this process. We know that there are issues. Dr. Raza talked about the scheduling issues, which is a state system. I will remind everyone, and she's been communicating. I know the other counties have been communicating that with the state as well. It's about making sure that we get the vaccine out to people. That's the only thing that matters. We're going to work with our state partners. We're going to work with other partners to make sure that we do that. Dave? Are you good? I saw you today. There's no speaker. Dan, last question.
Last question. I just had a question about the Ravens, if they have reached out to the city at all about using M&T Bank Stadium as a vaccination center, and if that would be something that the city would be willing to help expand the services here. So,
Dan, actually, I'm glad you said that. No, I personally will be reaching out to both the Ravens and the Orioles about that myself. And since this is the last question, go Ravens. Thank you, everybody.